Can everybody hear me?
Yes.
All this incredibly large turnout. Let me call this meeting of the Cannabis Control Commission to order at 9:47 a.m. Let me just ask: is anybody recording this meeting?
Yes.
Okay. Let me put the public on notice this meeting is being recorded. Can everybody hear me in the back?
Yes.
Great. Can I ask everybody please to take their cell phones and either turn them off or put them on silent? Thank you. Let me start by just introducing everybody that's here, and then I'll go through how we're going to conduct the meeting. Sitting on my left is Commissioner, first of all, I'm Steve Hoffman, the Chairman of the Commission. Sitting on my left is one of my fellow commissioners, Berta McBride. We have several members of our staff here. As a matter of fact, I think we probably have more staff than we have public here. And I'm not reading this in order of importance. This is just the order that people arrived this morning. So on my right, the far right, is Erica Stravelli, our Chief of Staff. Sitting to her left is Christine Bailey, our General Counsel. Matt Giancarlo is our Director of Constituent Services, sitting right in front of me. Martine Russell, our Digital Director, is over there. Mary Alice Gill was here.
She's womaning the table up front.
She's our Press Secretary. And Pauline Newen, our Associate General Counsel, sitting right here. So thank you all for coming. Let me just go through a couple things about the meeting. This hearing is pursuant to General Laws, Chapter 30A on Draft Regulations 935 CMR 501.000, medical use of marijuana, and 935 CMR 502.000, co-located adult use and medical use marijuana operations. The purpose of this hearing is to receive public comment on these draft regulations. The commissioners and the commission staff here will not be answering questions. There was something about limiting everybody to 3 minutes, but given that we have 2 people signed up, I think we'll let the 2 speakers speak as long as they'd like. If anybody else besides these 2 want to speak, you need to sign in. If you're just here to listen, you don't need to sign in. Please note, as I mentioned, this hearing is being recorded, so just be aware of that. We ask you to respect all speakers. No applause, please, no comments. It would be helpful, speakers, if you would provide a citation on the sections of regulations that you're commenting on. We also encourage speakers to submit their comments in writing. Those who are not speaking today but wish to submit comments can send them in writing to cannabiscommission@mass.gov. Written comments must be received by 5 p.m. today, which is the close of our public comment period. Please note that the transcribed comments from public hearings and submitted written comments are subject to disclosure under the Public Records Law. So with that, thank you for coming. And our first speaker is Stacy Fisk. Can you come up here, please?
Good morning.
Thank you for coming. Did you watch the Red Sox game?
Yes, I did.
Oh,
all
good.
of them.
Did you stay until 3:20 on Saturday morning?
No, there's no way.
How many people stayed up till 3:20 on Monday morning or Saturday morning?
My 80-year-old grandmother did. Yes.
Good for her.
I know.
The rest of you should be embarrassed about not being true Red Sox fans. Anyway, Stacy.
It's up to you if you want to stand or if you want to sit.
Yeah, it's like whatever smoke.
No, this is good. I'm just reading off my phone though, and I did not bring my cheater, so I'm very sorry.
Okay. Well, anyway, thank you for coming, Stacy.
Thank you.
Do you need a pair of cheaters?
No, I'm good. I think I'm good. Oh, okay. So I wrote this all out because I would never remember anything. So sometimes in life we come across opportunities to really make a difference in the lives of others who are in need. Please know that this is one of those times where you can truly make a difference. At the age of 5.5 months old, my beautiful daughter Ashley had her first seizure. It was one of the scary, life-threatening types, grand mal, and I actually thought she was dying as we raced to the hospital. That was 12.5 years ago. Since that day, Ashley has been diagnosed with Dravet syndrome, a rare and catastrophic form of epilepsy. She has been placed on at least 14 different anticonvulsant drugs over the years, each one taking a toll on her life with their devastating side effects. These pharmaceutical drugs have caused more damage than the seizures themselves. Thankfully, our wonderful neurologist, who is also the chief pediatric neurologist of the Epilepsy Center at the Massachusetts General Hospital, included Ashley in a clinical trial several several years ago using cannabis as a treatment for Dravet syndrome. Finally, Ashley became seizure-free for long stretches of time and gained her cognitive and physical abilities back by leaps and bounds. Since the clinical trial, my husband and I obtained our medical marijuana cards and now are purchasing high-quality, lab-tested cannabis. We also grow it. After almost 12 and a half years of living and breathing Dravet syndrome, I can assure you cannabis has saved Ashley's life. Her health was spiraling out of control before cannabis due to the intensity and frequency of the seizure activity as well as the side effects of the pharmaceutical drugs. While we are thankful to have the opportunity to legally medicate our daughter in the state of Massachusetts, there are major issues we are still facing. One issue is the fact that our private nurse is not allowed to give Ashley cannabis. The nursing agency will not allow it. They are scared of the potential consequences they may face without the proper laws put into place. Seizure activity can come at any given moment. We must avoid seizure triggers at all costs. Overstimulation and overexertion are two main triggers for children with seizure disorders. Therefore, running simple but necessary errands like grocery shopping puts Ashley at serious risk. So I must leave her with a nurse, but it defeats the purpose if I'm unable to leave the house because the nurse cannot dispense her medication. Ashley must take cannabis as a daily maintenance medication, but also she must have it available during crisis situations. If Ashley has a seizure, cannabis is needed to stop it. Otherwise, she is at risk of being hospitalized and absolutely will be given heavy-duty doses of pharmaceutical drugs, since cannabis is unfortunately forbidden on campus. My daughter is put in a zombie-like state and she is unable to walk or talk properly for several days due to the side effects of these drugs. This all can be avoided. I ask in behalf of all parents treating their children with this life-saving medicine, please consider the institutional caregiver proposal. Our nurses, whether private or working in healthcare facilities, should feel confident dispensing cannabis to their patients without fear of losing their nursing licenses. Additionally, we face the ongoing challenge of legally growing enough plants to formulate Ashley's cannabis oil. Over the years, we have consistently increased her doses, and 12 plants just isn't enough. Since Ashley is extremely sensitive to any changes with her pharmaceuticals, as well as her cannabis oils, we must formulate using the same strains. We do not have the option of buying her cannabis oil at a dispensary, as they do not carry the strains we need. She needs the same strains of plants every time or she will have seizure activity due to the changes. It's extremely stressful to think about the consequences if she does not get her medicine. Please consider allowing patients to acquire hardship licenses to grow the necessary amounts of plants needed for their medicine. And the last issue I'd like to address is the pediatric patient registration process. Currently, we are forced to file hard copy applications through the mail. This creates such a hardship for our special needs families in the state of Massachusetts. There is much confusion most times when a call is made to the customer service reps at the DPH with a question. In turn, mistakes are made when filling out the paperwork. Our paperwork has actually gotten misplaced at the DPH, which caused a lapse in my daughter's registration. Having to send paperwork back and forth through the mail is inefficient and creates unnecessary stress. When you have a medically fragile child in a wheelchair, it's very difficult to transport them to a store or a post office to get that passport picture taken needed for the registration process. The picture has to be just right or it will be rejected. Filing online and picture taking should all take place in a doctor's office. In behalf of all of our pediatric families, I ask you please consider modifying the software needed to file online for our pediatric patients. Thank you so much for your considerations.
Thank you very much and good luck to you.
Thank
your daughter.
you.
The next speaker is Julia Agron. Again, stand or sit as you whatever's most comfortable for you.
See me over this?
I can if you need to. Yep, you're all set.
My name is Julia Agron. I wanted to start off by saying I'm here both as a patient, as a professional in the industry, and as a parent. I kind of feel like, to some extent, parent got covered really well. I can't top that. But I will say that as a parent, it's not only children in such extreme situations that benefit from cannabis as medicine. It's showing so much increased viability as an option for ADHD and ADD medication, and a host of other. My daughter suffered from migraines. I wish it was a viable option for her, and it's really prohibitively difficult to obtain a card for a pediatric patient in this state. And there's only 2 doctors. One of them has talked about retiring repeatedly, and it's hard to think about both obtaining and maintaining a pediatric card. And you heard about some of the other reasons, obviously, why it's difficult. And I do urge you to consider that, we're still maintaining a lot of the stigma when we're not treating it as a viable medicine for people of all ages. And obviously, we've made a really clear distinction between recreational, adult use, and medical, so I hope that the full range of medical can really be available to all of the patients that benefit from it. And the other part of what I want to talk about is mostly my experience as a professional in the industry. I was one of the management team that opened the largest dispensary in Western Mass and helped run it for 3 years, so I obviously saw a lot of patients. I honestly probably saw more patients than anybody else in the state because we were the only store for 2 hours for anybody to come to, and we had patients coming from as far as Martha's Vineyard to the borders of New York, Vermont. It's really hard. It's really hard for a lot of people to be and to maintain their cards as patients, and it shouldn't be, because so often we're dealing with the most vulnerable population. The largest group of medical marijuana users in the country are the elderly, and there's no group that it's harder for than the elderly. I saw so many people literally give up in frustration, let their cards lapse, or give up on trying to get cards because it was so hard for them. The computer process is challenging for somebody who has minimal computer skills, and there's really not a lot of great places to go to ask for help. You're not necessarily comfortable asking for this at the senior center or the library, and every part of it involves a skill set and a computer that a lot of our patients don't have. Elderly, it's difficult for poor people to have access to the kind of technology that is needed, and doing it by paper is so hard. It is so long, and you wait for weeks and weeks for the letter to come and say your picture wasn't good enough, and then you have to start all over. And while we really fought, and I don't want to say fought, while we really worked with the DPH to minimize some of these difficulties, and they really did meet us as much as they were able, they would tell patients that if they started on paper, they couldn't transition to a computer system, even if we were willing to literally sit in the parking lot in the winter with a computer and help them, because we can't let them in the building. And I had staff every day out there, bundled up in coats, huddled against the wind with patients, trying to help them maintain their medical status. It's so heartbreaking. And literally to see patients who, when it's time to renew, give up, get frustrated. We would try to get on the phone with the DPH, and because we're not their caregiver or the patient, it's really difficult. And to be perfectly honest, and I never talk bad because the DPH has a whole lot on their plate, but they weren't always easy to deal with. It's just got to be better for people if people are going to stay patients, and there are such good reasons for people to stay patients. Recreational adult use is not a replacement for the safety of being a patient, for the knowledgeable professionals that come with being a patient, for the protections, and for a lot of people, they're not going to go into recreational stores to get their medicine. People are already scared about what's going to happen. A lot of people deal with anxiety and depression who are using cannabis, and they're already worried. So just knowing that the safety of being patients is there for them is really important. So I just, I don't have citations for the parts that need to be better. I apologize for that, but I can tell you that start to finish, you get medical cards that don't have the date that they actually need to be renewed on them. That's really tricky. So you have multiple dates to maintain. You have doctor certifications that, frankly, I've helped a lot of patients since I left the dispensary just as a consultant, and there's a real range of doctors dealing with this as well, and some of them are incredibly helpful, and some of them are incredibly expensive and not very helpful. So patients, from the very beginning, it's prohibitive, it's expensive, and it's difficult. Then they get to the computer part, and so often they feel completely alone in that. And then a year later, they kind of feel like they don't know what's going on all over again. Not to mention the doctors who are sending out 6-month reminders and check in within the first 8-week reminders, and the patients don't know if it's legal, and they don't know if it's necessary, and they don't know if they're about to lose their card, and they finally got the first bag of medicine that they're going to see if it works for them. So it's really scary and hard. And So there's all of these like different factors to manage, and insurance doesn't cover it, which I guess a lot of this is beyond like just the scope of the CCC, but I'm afraid you guys are gonna have to fight the good fight for all of us. And Mass Health should cover medical marijuana. We've decided that it's a medicine in the state. By a really large group of people, we decided that, and it's been working, and the numbers show that it's working, and the health insurance that the state provides, at least, to the people that the state has determined are the most underprivileged population, they should be able to get their medicine the same way that they can get, antibiotics, or Valium, or painkillers at a CVS. It should be just as affordable for them. I spent a lot of my time explaining to people that medicine is expensive, they just don't really pay for it most of the time. So it's hard when this medicine is completely out of pocket, especially again, for the elderly, for the underserved. So I really appreciate that you guys have a huge mountain ahead of you, and I am super confident that we have good people doing it, but I just wanted to make sure that you knew that it was it's really important to protect our patients and to make it easier and more accessible for them.
Thank you very much, Juliet. Really appreciate your comments. We got a few more sign-ups, so let's keep going. The next speaker is Kathleen McKinnon. Morning, Kathleen.
Good morning. My name is Kathleen McKinnon. I'm the Vice President of Clinical Operations with Cannabis. And I'm here today to talk a little bit about the medical regulations and the way they're currently written, how they may transition over, and what that looks like. Right now in Massachusetts, the regulations are such that patients can come into the doctor and get certified. There are regulations within the laws that state that physicians cannot go into a dispensary and do certifications in a dispensary, and I understand that perfectly. We look at this as a medical issue. We are collecting data. We are doing research. We're involved very much in a lot of research within our own company, as well as taking it nationally and globally. So that's something that we really feel near and dear, is near and dear to our hearts. We look at this as patients that are coming into our office seeking guidance. We provide education for them. To echo some of her sentiments, we do see a lot of patients, elderly patients, especially in this area, we're in Northampton, that come in and do find the system onerous, and we try to help them as much as we can with that. But what really I'm here to discuss today is where these certifications can take place, what is allowed within the regulations. We do see some other groups that are out in the dispensaries doing certifications right inside of dispensaries. And it is clearly written in the regulations that that cannot happen. In the physicians for guidance, the guidance for physicians through the Mass DPH states that doctors cannot go into an RMD and do these certifications. So my, question, or, what is the medical program under the CCC going to look like? Are certifications going to be allowed to happen in hotels and parking lots and bar rooms and dispensaries? Because they have actually happened. They actually have happened in all of those places. So, our hopes is to keep it medical, is to keep it, above board, really work on the research program along with C3RN and a few other groups, dispensaries that we're working with to really get that information for the state and for the country. And so, my hope is to keep it a genuine medical program for these patients where they have a safe place to come in and speak to an educator or a physician or a nurse practitioner. So that's kind of why I'm here today, to kind of get some guidance and see what it may look like down the road under the CCC, and hopefully we can keep that in a very nice medical professional system and be able to collect the data that's so important for years down the road.
Thank you very much, Kathleen.
Thank you.
Appreciate your comments. I'm going to probably screw up the next name, and I apologize in advance. Rebecca Carino. You good?
Yeah.
Okay. Next speaker, Marie Robinson. Good morning.
Good My name is Marie Robinson, and I am considering seeking a product manufacturing license on the recreational side. As I navigate our potential customers, of course, we can't sell to the end consumer, so our customer will be retail license holders on the rec side, which is a very small number at this time. And it would benefit a small business to be able to share our products with the medical dispensaries that exist today. I know they are bound to, I believe, sell only products that they make themselves, and that there is no dosage cap on the edibles that are sold in dispensaries. On the rec side, we would not be able to make any products that exceed 100 milligrams, and there is a huge market for people who demand more than 100 milligrams to get any relief. So again, just when taking our customers into consideration on the rec side, as a small business, I feel a little scared because that number is very small. So if medical dispensaries were an option for us to share our product, I feel it would be more beneficial for everyone involved. That's it.
Okay, thank you, Marie. Appreciate it. Nobody else has signed up. Is there anybody else in the audience that wishes to make a comment?
I'll make a comment.
Please, thank you. Please, since you're not signed up, could you give us your name?
Yes, my name is Gerardo Ramos.
I'm sorry, do that again?
Gerardo Ramos. I agree with Marie, what she's saying. Received our economic power certificate, and we're looking to build a cultivation facility in Holyoke. And I agree with her because I could grow a great product that I can then supply the medical industry, which the medical industry that can extract and make medicine out of it. I mean, there's something that should be looked at and allow us to do. That's all I have to say.
Thank you, Ron. Appreciate it. Is there anybody else? Would any of the staff like? No.
Just chat. Any thoughts from you?
Okay. Yeah, let's take a break.
Yeah.
So just to give some people that might be still sleeping in from their celebration of the Red Sox, it's 10 past. We're going to just take a short break. We'll come back, let's say at 25 past, and you all are welcome to stay, but we'll give other people a chance to show up over the next 15, 20 minutes, okay? Good idea. Thank you. So we're going to take a break.